I'm 40 now, I'm 50 now, whatever birthday it is, seems to be enough of an explanation for a lot of people that it's going to just be there for the rest of their life. And I guess I'm a cheerleader to the opposite, that it really doesn't have to be that way.
Hey there, welcome to the Evolving Ageless podcast. This is the enlightened woman's antidote to aging. I am Michelle Dreilich, and I am on a mission to change the way women age. So as host of the Evolving Ageless podcast, each week I invite experts in their field to help us little by little learn about changes that we can make in our lives that help us evolve ageless, right? So today's guest, this is going to be such an important topic, and I'm excited to bring it right to the forefront. We're going to be talking today about joint pain and chronic joint discomfort, and knowing and learning ways around establishing hope that this can actually be reversed and that your body can regenerate. Is this exciting? So I'm joined today by my guest, Dr. Angela Cortal. Dr. Cortal is a naturopathic physician. She's from Oregon. She has 2 physical practices in Oregon, but also has a virtual practice. And her area of expertise is on joint health and helping regenerate joint pain. Mostly, I guess, in all people, but very much so for women. So depending on any stage of life, Dr. Cortal has a very unique approach that she takes with patients so that they can actually address all of these hidden factors that contribute to chronic joint discomfort, joint pain, arthritis, whatever you want to call it. So I just want to say welcome, Dr. Cortal. It's so good to have you here.
Well, thank you. Thank you for having me.
Absolutely. So we're going to kind of jump right in on this because we've talked before and talked all about this idea that joint pain for people sometimes comes on rather slow over time, but then when people have it, they have a very difficult time resolving it, right? And I think very often they just think that this is how it's going to be for the rest of their lives. Do you see that in practice?
I see that in practice. I see that in our community, friends, family, just about everybody. It seems like through our maybe 3rd, but certainly 4th decade of life, and then continuing on, that this aches, and then it just gets contributed, or I should say attributed to, well, that's just how it is. That's my age. I'm 40 now, I'm 50 now, whatever birthday it is, seems to be enough of an explanation for a lot of people that it's going to just be there for the rest of their life. And I guess I'm a cheerleader to the opposite, that it really doesn't have to be that way.
I love it. I think it's such an important conversation because we have this talk so frequently on Evolving Ageless because there are these norms that society says exist, right? And it's as you get older, you will ... fill in the blank, right? You will feel uncomfortable a lot of the time. You will not be able to sleep well. You will slow down in your activities. And so I think this is a really important one, though, because I know that joint pain and joint discomfort and arthritis and all those other diseases that fall into that category are debilitating, and they completely shift the trajectory of your life, right? This is the difference between what you want to look like 20 years from now, 30 years from now, 40 years from now. They make a big difference in the way someone's outlook for their future kind of shapes itself. Would you agree with that?
Well, yeah, completely. And it affects how someone can be physically active, their exercise. They may start paring that down over time. Like, I can't do this anymore. I can't do that anymore. If their work has any physical component, or they're retired and now we can't go on this trip or go golf, or it's just like someone's world just shrinks and shrinks and shrinks over time. just allowing those processes to continue.
Absolutely. So if this sounds like you or anyone you know, you definitely want to pay attention to this topic, because we're going to dive in and give you hope and give you really quick things that you can start to do just as soon as you finish listening to the podcast, just to get started on that road. So I know that you've got a book in the works, and you have this approach. You call it the 7 steps for younger joints. So just at a high level, and then we'll get into them one by one, but at a high level, what are those 7 steps that you really focus on whenever you're first working with someone that has chronic joint discomfort?
Sure. Yeah. Well, I'd love to delve into this. So we got to begin at the beginning, and that is what is really going on. And if you're told you have arthritis, that may be a component of what's going on. That may or may not be the only thing. And so a really important piece of my work with patients, and something that I also teach to our community online, is the cartilage thinning down. What people may call osteoarthritis or bone on bone can be a cause of pain, but also we have ligaments, tendons, muscles, nerves. There's a lot going on there, which any and each of those can have a component of injury or inflamed, or maybe they're lax, they're weak, they're not holding up what they should be. And so that's kind of step one, is figuring out what are the sources of someone's pain, what is the complete picture that's going on, before transitioning into other, well, what do we actually do about it steps, like assessing nutrition. Is someone getting adequate building blocks there? Are they under eating, or just eating in a certain way that's not providing them everything that they need to heal all of those tissues I just mentioned? And then going into movement, what is someone doing, or what are they told they can't do or shouldn't do, and kind of layering in what is the right type of movement for what someone has going on. Then going into lifestyle pieces, and anything and everything that you've been told it's good for you is probably good for you also on a musculoskeletal level, like adequate sleep and stress levels, and just mindset around change, around having a supportive group of people or community, where you can make positive changes and are supported through that. Then I look at hormones, and I am a big advocate about how important hormones are for our bones, cartilage, ligaments. All of our skeleton is really finely tuned to our hormone levels. So as we can often go through various decades of life, and those things shift, they have a really profound impact on our cartilage's ability to heal. Even discs in the spine are very finely set up to be aware of our estrogen levels. So should those change, such as through perimenopause, menopausal transition, the disc tissue, the cartilage tissue, will not be receiving the same signals that it was previously. So I find that hormones, and in addition to estrogen, also progesterone, testosterone, but other ones such as thyroid, even insulin. All of these are hormones, and all of these have a huge impact on our healing rates and our ability to regenerate this tissue. And then jumping off from hormones, then I'll look at nutrients, certain supplements, depending on what we're needing to support. So it's not necessarily that these are the very first thing, but from an individualized approach, they can be really key pieces. And lastly, so now we've gone through 6, and our seventh one is saying, is there any type of more interventional regenerative medicine that we can be using, such as the injection therapies like Prolotherapy and PRP, which stands for platelet-rich plasma injections. So I do those. I've been providing those, I would say, for about 5 or 6 years for patients. They can work phenomenal, but just not as good if we don't have everything else set in place.
All right. So I'm so glad you got through those 7. I'm not kidding. I'm like sitting on my hands wanting to jump in on every single one of them because there's so much goodness in there. Like we're going to get to hormones in a second. I don't want to start with it, but it's so good. Okay. So diet, let's start with that one because that one's the most common. It's the easiest one for us to talk about, probably the hardest thing for people to change. And we talk about it all the time on Evolving Ageless about whole food, feeding yourself from the earth, limiting processed foods. So why don't you tell us about nutrition and diet as it relates to joint pain and joint discomfort?
Yeah, definitely. So you mentioned previously, and it's true, I do see mostly women, and I will say that a lot of us women out there as a group can undereat, and that's just a factor of take your pick reason why.
Body image. Should start with that. Yeah, right.
Many reasons why. But under eating is providing not enough building blocks on a physical level for us to regenerate. So tissues will be weaker, not as strong. And so just getting enough food in, getting enough protein in is definitely something. I had heard some of your previous podcasts. I don't remember if it was Dr. Cook, maybe, who was talking about protein, and yeah, like 2 thumbs up to that. Women, most of you need to get more protein in. And this isn't something that we just can psychically know. Most people can eyeball how much water they're drinking every day, but protein is a little bit more, it's a little more difficult to put your finger on it. So looking at, I don't know, using an app or working with someone who will be calculating these for you for at least take a couple of days. This is often what I'll tell patients or clients is take a few average days and calculate that out. And it gives you some good numbers, because I can say if you do that and you're averaging 40 grams of protein a day, you're not going to heal. You're just not going to heal as well. Versus if it's double that or higher, then you're actually giving yourself a fighting chance to reverse and to heal some of these that we're talking about.
And I think of it like this, like if you think of protein as the building blocks, basically, of just about everything that our body makes for itself. I always think of it like building a house. Would you ever build your house without cement? Like you can't. I mean, you could start with wood. It's not going to be a strong foundation. It's not going to hold up in a storm, i.e. disease or in the face of injury. So, you need the building blocks to build that foundation. And I think what happens with women is that we cut back on our protein, like animal protein, unless you're a vegetarian. If you eat meat, you tend to cut back on your servings of meat and want to eat more vegetables, which is fantastic. I would never dissuade someone from that. But be mindful still of your protein intake because it's different when the predominance of your food is coming from vegetables. You have to pay closer attention to your sources of protein. So I think that's fantastic advice.
Mm-hmm.
Yeah.
And then jumping off of the protein. So looking at collagen, is someone consuming any actual collagen or precursors of collagen? And when I'm getting into these nitty gritty with patients, a lot of our even healthy, but American type of cuisine as opposed to other countries around the world, we don't really inherently have sources of collagen. We're not eating pork knuckles or chicken feet or something like that. That's very rich in collagen, just not present in the American diet. Those of us omnivores are eating muscle meat on a technical level. That is what it is.
Right.
Can be a great source of protein, but not necessarily the collagen. So I look and see if that's present and introducing, is it a bone broth or a collagen rich type of like soup or stew, or what kind of ideas can we put into just having some new recipes that someone will eat.
And the things that help bone help collagen, right? So things like vitamin D and K and biotin and all of those things help us generate bone, but they also help us generate collagen too. So finding those foods are great for us.
Yes, so bone is about 60% collagen fibers, and then the rest is all of the minerals, and vitamin D is important, and vitamin K is important in that way.
Yeah, that's fantastic. All right, so let's talk now about the diagnosis, because I found this fascinating, but I guess I'm not surprised by it. You know, I think so many women hear, oh, you have arthritis. That's your diagnosis. It goes into a bucket, or a waste can. And I have a personal story with this, so I'd love to hear if you feel this is common or not. But it was a long time ago. I was in my 40s, early 40s, and I couldn't raise my arms above my head, both of them. They just stopped, right? And it was uncomfortable. I couldn't sleep at night, and I had MRIs. There was no damage in my joints. There was nothing. And so they said, you have arthritis. And I went to ortho. I went to an orthopedic. I went to a pain management person. And all they did was say, we can give you injections of cortisone. We can give you lots of ibuprofen. And if you don't like that idea, we can give you some prescriptive stuff that is kind of iffy even on the market, right? Some, products in that class have been removed from the market, and they want to give me something else in that category. And so I will say this, it took a year and it went away. And it was like, it's very slow, but it went away. And I don't know what it was, but, and I don't even think that's the relevant part of the story. I think the relevance here is I was stuck in a system that was labeling me as having chronic arthritis and was trying to layer medications on me as though I had chronic arthritis. And so let's talk about that, because I know what you do is completely different from that.
Mm-hmm. Yeah, and I would say it really gets down to what is someone's goal, because if someone's goal is just make the pain signals go away, put whatever we need to, Band-Aid on that situation, just make the pain stop, then yeah, ibuprofen works fast. Cortisone injections work really fast. That's what the goal is, and that's one approach. And mine is really, let's delve into it. Let's figure it out. Let's work through everything and see what for each unique person, what is relevant for one person versus what is for the other. And in the case of some, let's just say shoulder pain, that could be from the cartilage, that could be from the joint capsule, labrum, ligaments in the area, tendons. I mean, they're muscles, nerves. Shoulders are very complex. There can be a lot going on, and no two cases of shoulder pain are going to exactly be alike. They're two people are not going to have exactly the same pain generators.
Right. And that makes sense. And you also mentioned very often the diagnosis isn't thorough, right? So we might get this diagnosis like, I have arthritis, and it's not unusual for us to wear these labels like, oh, I have arthritis. But sometimes you'll go in and you'll do a much deeper assessment, right, of that area. As you mentioned, it could be ligaments, it could be muscle, it could be bone. And you find very often it's not always misdiagnosed, but very often it's incompletely diagnosed. Is that how you would describe it?
Yes, because I would say as a general principle, often my patients will associate, like, I have blank pain, and it's knee, hip, low back. I'm told I have arthritis, and that's often the end of the story as they are told prior to seeing me, and then we just kind of dive in, and through history, through looking at imaging that's been done, through listening to the patient, finding out what in the past have they been doing, what's been working, what did they try and didn't work, and putting all those pieces together gives me an initial framework to then jump into a physical exam and really dive down into all those teeny tiny little structures that can cause pain. Because if it's a ligament that's just an inch big, that could be make or break for somebody, and they won't know unless we get to the kind of to that level.
That's great. And it's important, right? It gives you a recognition. Hopefully everyone listening that suffers from this realizes it could be more than just what that simple label was. So maybe you can go a little deeper on that. So that's fantastic. So now that we've got the nutrition in place. We've got the diagnosis. You've got the right diagnosis in place. Now you move into movement, lifestyle, mindset, all of that. Let's talk about some of those things.
Yeah, so I will very often work with trainers, with movement therapists, with sports medicine chiropractors. I have quite a large community of people, so that I can kind of start the conversation and tell them what our goals are with movement, and then they can actually be working with someone one-on-one, be able to be observed, guided, corrected through. Is it a matter of turning on some muscles around an area that hurts? Low back pain very often is surrounded by very weak low back muscles and glute muscles, and some of those muscles are maybe inactivated and haven't been turned on in decades, and so we need to get them on. And so I can kind of start that process, and then help guide my patients, clients, to where they can actually be able to be working one-on-one with someone, like in a gym or a fitness realm.
Oh, that's great. That's life-changing right there, right? When you recognize that the structure is being compromised because of our muscles are supposed to support it, right? And our ligaments and everything's supposed to support it. And I've always heard, right, weak abs lead to low back pain, right? And I can notice it when I don't work out for a long time. And then when I start working out again, the first thing is my low back pain because my abs are so sore, right? So they're definitely connected in there as well.
Yeah. I guess what we can say is that joints are supposed to move us. They're supposed to move, but it's really the muscles that are supposed to be kind of taking a lot of the strength there and doing a lot of the resisted movement. And if the muscles are weak, if the muscles are turned off, there's going to be a lot more force, a lot more impact, and just over time, a lot more wearing of that joint.
Ah, that makes so much sense. So much sense. So what role does lifestyle play? Like lifestyle meaning sleep or stress or even things in our life like alcohol, things like that. What role does that all play in joints?
Well, it's really key, and it all comes down to all of these have an impact on how we heal, literally our regeneration. So whether we're talking about cartilage or ligaments, muscles, tendons, all of those are cells on the microscopic level. Those are cells that turn over, that regenerate, and we need to be providing all of the right environment for that. So chronic undersleeping, someone's not going to heal as completely, not heal as fast as they otherwise could be. Same with chronic high levels of stress. And that can be high stress going on for long periods of time, or this kind of intermittent, really, really high stress levels. And alcohol is the same. So all of these, I'd say they're, in using a medical phrase, they're kind of dose dependent. So if there's just a little brief period of stress, that's not going to have as big an impact as having a high stress work environment, or just feeling chronically stressed day in and day out. And same with sleep. One poor night of sleep may not have much impact, but if it's, under 6 hours every single night, day in and day out, year after year, we do most of our healing while we're sleeping. So we really need that in peace. And the same with alcohol. Also, 2 glasses a week is going to be a lot different than 2 glasses every single night.
Right. Wow. I never thought about it as all being dose dependent. Sleep,
Yeah.
stress. That's great. And we've talked on previous episodes about stress, and stress as almost like a biochemical process, right? Is inflammatory. Cortisol kicks off this process. Insulin spikes, and once insulin is busy, there's lots of inflammation. And so this idea that it's a cascade that happens, and we wouldn't, I know I've said this before too. We always think of stress like, yeah, I know I need to reduce my stress, or I can't get rid of it. I have to manage it. But until we start to take it apart and explain it, I think on a chemical level, like it's not about how you're feeling. It's about what it's doing inside of your body. And it's just the same as eating a glazed donut inside of your body when you live in this state of crazy stress. And so if you're going to eat a glazed donut, you should at least taste it. not live in a chronic state of stress about it. So, all right. So the thing that I was sitting on my hands for was hormones because I had no idea. I'm so excited to hear about this. So hormones have a relationship to joint health and bone health. So let's talk about all of that because that has something to do with how we age.
Yes, yes, it does. So starting with bones, we can talk about bone mineral density. And anyone out there who's had what we call a DEXA scan, and this is looking for osteoporosis, osteopenia, we can common phrases, bone thinning there. This is often checked, I would say, 50s, 60s, 70s. In that age group, very generally, we're starting to check that. And if any of you have mothers or grandmothers, this is often where people are knowing whether or not they have a family history of low bone mineral density. And we know that those that have lower of the sex hormones, we call them, so the estrogen, progesterone, and testosterone, predominantly it's the estrogen and testosterone for us women that are important. If those levels are low, then it compounds what would be an increased risk with the family history. So it's kind of a double hit there. If you have your mother and grandmother, they had osteoporosis. One of them may have had, say, a hip fracture in their 80s. This is a very common sort of story. Then that plus the low hormones can mean a increased risk for someone getting osteoporosis earlier and for it to be more severe, basically for that bone mineral thinning to happen at a more accelerated rate than it would otherwise with adequate hormone levels.
Whoa. So that means as we go through menopause, right, or through perimenopause and become menopausal, that slow decline in our hormones is impacting. So it's almost, it is a side effect or a symptom of aging, right? Is when, we always talk about with aging, wrinkles are the first thing we think of as the first sign of aging. And we always dispel that myth because it's all happening on the inside. That's one visible sign on the outside. But bone thinning is another. And when you mentioned the double whammy of family history, it's unlikely that someone's grandparents or elderly parents had true bioidentical or hormone replacement or anything like that. So, I mean, the likelihood was that was the natural aging process happening in conjunction with a poor lifestyle potentially or all those other things, right?
Mm-hmm. Yeah, definitely.
Wow. So I know. So say the thing that you said again about the spine and estrogen.
Yes.
That was.
So the more I keep looking into research, the more we can find. How I'll say it is at this point, I can't identify any structure of our skeleton that isn't responsive to hormones. It's there, it's in the research, and it's really interesting to me. So in the spine, so we have our vertebrae, which are the bony segments, and then we have our discs in between that are supposed to be the squishy shock absorbers. And what we see with women, usually, let's say 60s into 80s, is that those with the lowest levels of estrogen are the most likely to have degenerative disc disease. Basically, those squishy shock absorbers are kind of drying out, they're thinning out, they're becoming more crumbly and instead of squishy, how we want them. And so that can lead to actually just a lot of disability because our spine as a whole is supposed to be absorbing a lot of the shock of our impact. So estrogen has a really important key role in keeping those discs as healthy as possible, and the same as cartilage also. So cartilage we have in most, if not all of our joints, at least on a very, very tiny level. And I'll explain to patients. So it's similar to the discs where it does have an element of shock absorbing, and also the cartilage as a layer over the bones is really providing a smooth rolling surface. And we want to keep that surface as kind of smooth and whole as possible, because if it degenerates and gets like nicks and chips, I'll call it, irregularities in that surface, that's where we'll get some of the pain and crunching and popping and just unhappy joints. And so estrogen and testosterone have really important roles in cartilage cell regeneration as well. And we can see there's dozens, if not hundreds of studies now looking from animal models and also human interventions where pretty much across the board, low estrogen and low testosterone means earlier onset osteoarthritis. So actually having a clinical diagnosis of the cartilage thinning and the degenerative processes around that joint, and for it to also be more accelerated. So earlier and worse.
Wow. That's exciting. It's breakthrough, but it's scary.
Yes.
And because we've talked in many episodes, one that comes to mind is Dr. Shelton's. If you missed Dr. Shelton's talk on hormones, absolutely go back to that episode and watch it as a primer to this conversation, to really understand the role that hormones play in our overall health as women, especially. And so I'm going to ask you this question. It might come out of left field, but so, we talk about muscle mass, muscle and collagen, that all kind of goes hand in hand with aging. And I think very often, we see these frail little old ladies and we're not really sure, we as society think, oh, she's aging. That's an aging woman. What she's doing is she's losing massive amounts of muscle. Her collagen is completely broken down. And she's more susceptible to hip fractures and things like that, right? Because that's a sign of what's happening next is bone follows, right? So, wow. So that's all connected in this whole process of joints as well.
Yeah. And I've said for a long time, so I love and advocate and do a lot of strength training and weightlifting. And my whole long-term goal is to not be a frail old lady who fractures their hip. It's in my family history. I have a thin frame. I know my risk status right there. And so, yeah, that's my life goal, is to be as strong as I can, no matter what the birthday cake says.
That's right. Oh, and I say it all the time. People are probably tired of hearing it, but when you get to the top of the hill, right, you stay there as long as you can. That's what we are working on here. We are not, my family jokes and calls me over the hill. And I always say, no, I'm at the top of the hill and I'm staying there as long as I can, right? Extending my health that way. So hopefully these are little tips and tricks that are helping everyone along the way. So let's talk now about, okay, there's supplements we've all heard about, the famous supplements, right? Like glucosamine and chondroitin. That's the one I think almost everyone reaches for first on their own. But I'm sure you use that, but I'm sure there are other things that you incorporate into it. And this is not suggesting that anyone go out and start taking all of this stuff, because it's very personalized depending on what your specific condition and specific diagnosis is. But what are some of the things that you look to?
Sure. And yes, although I don't know each and every audience member listening to this, I can definitely share with you what some of the research says and sort of what my clinical experience is with preferences for different forms and formulations.
Oh,
great. So with glucosamine, I like it just on its own. And the reason for that is I think the research is very clear that it works well on its own, and it will competitively work with the same receptors for chondroitin and MSM. And so what I'm saying there is, if we have a receptor that's only going to take one of these molecules, they're going to be fighting for the same one. So I think if you're using glucosamine, just go ahead and use it plain. And almost all of the research looking at arthritis is using 500 milligrams 3 times a day. So I can tell everyone, please, by all means, go and look at the research for yourself. But I can say that's pretty much the most classic dosage that they're looking at in terms of seeing improvements with joint pain. Specific
That's fascinating. I never realized they all competed for the same receptor. So when you take a blend like glucosamine, chondroitin, and MSM, you're really getting a lower dose of each individual because they're all landing in the same spot.
Yeah,
that makes a lot of sense. Okay, so glucosamine by itself.
Yeah, I think that's reasonable, and that certainly it doesn't appear to need the other ones. I just
Yeah, great.
I don't see much of any benefit there. Another compound that I think there's some important differences is the various turmerics out there. And turmeric is something that just has an extremely long history used for inflammation, for immune system health. I'm not an Ayurvedic practitioner, but I do know that it has a very long history of use. And where I think that it can be helpful is specific to joint pains that are a little bit more, have a high, I guess we could say a hot inflammation. They're feeling more red, more hot, and no, it's not because of an infection. It's just the various inflammatory processes in a shoulder and knee, a hip, for example, where it actually feels warmer to the touch, and that's something that I can feel, that patients can feel. And turmeric also has a lot of research with rheumatoid arthritis, which we haven't touched on at all, but it's an autoimmune reason for someone's joint pain. And with the turmeric, there's literally just the turmeric root dried up and put into a capsule, and that's one version. Now I'm seeing a lot more of those using black pepper to increase the absorption, because if we're taking this orally, it's got to go through the digestive tract and get all broken down to its little components and float around everywhere and get to the joints that we're needing it. So the black pepper helps with that. But I'm really a big fan, based on what I see, really great research out there with the bioavailable forms of curcumin, where they've basically taken the curcumin extract from the turmeric root and complexed it onto a fatty acid. And so it's really created something that's a plant root to a little bit more recognizable by our digestive system with that fat. And I see it as like a fast track getting it in. And it's been a few years, handful of years ago, there was some research where they actually looked at shoulder joint pain. And this is something that maybe not a lot of people would sign up for as a research participant, but they took samples out from the joint fluid of the shoulders, and based on different types of supplements people were taking. And so with just the turmeric capsule, they found a certain level of the curcuminoids, curcumin compounds in the shoulder joint, versus the bioavailable one was about 23 times as much.
Wow. And I'm so glad you said that, because curcumin, which is turmeric, by itself is not readily bioavailable. And so you're right. I've seen this trend of adding black pepper that increases the bioavailability. But even Dr. Pizzorno says black pepper is not an ideal compound that you want attached to your curcumin, because it's increasing bioavailability by punching little holes in the gut. So the idea that there is a more bioavailable version of curcumin. So what do people look for? They look for turmeric root, and they're looking for some kind of fat.
Sometimes it says bioavailable. I don't have any affiliation with any of these brands, but sometimes it'll say Mariva, and Mariva just means it was the people who make Mariva. That's just one. I guess we could call it a name brand of an ingredient.
Yeah, that's the patent for the bioavailable one. Yeah, and that's in other people's products. So
exactly,
they're just a raw materials company. But yeah, that's a good one to know about then. So maybe look for that, because you'll see bioavailable, and then it's black pepper that's making it more bioavailable. So I love that tip of looking for one that is truly more bioavailable in a more natural way. Okay, good. So that's good. So we talked about turmeric. What else?
Oh gosh.
I've heard hyaluronic acid. Does that work for people to take orally? Do you recommend that ever?
Short answer, no. No. I'm not really impressed with it. I think it's probably not harmful. If anyone says that their joint pain is phenomenally better on it, then I'll accept that. But I'm specific to joint pain, because I know it's in a lot of also sort of like cosmetic and other products out there. I don't have experience or knowledge about that realm. But specific to joints, I'm not really impressed with the oral or even the injectable kind. There's all sorts of things that are injected into joints, for those who don't know. So we talked about cortisone, which is a steroid, and then hyaluronic acid and Synvisc, which is made from rooster combs. And there's a couple of other compounds that are similarly out there. The idea is decent, which is you need more of these sort of cushiony tissue in this knee. This knee doesn't have enough cartilage, it's bone on bone, let's put some of that in it. But you're kind of short-circuiting the whole system instead of trying to, from my philosophy, as everyone can figure out, it's really to build from the foundation up versus just putting that cushion in and not addressing any of the other factors. It doesn't seem to have really much long-term results at all. It basically just breaks down and goes away.
Oh, that's good. So that's important for people to know. That, I mean, again, unless you're getting phenomenal results with it, if you're taking it, you're not noticing anything, then that's probably what you would expect. And so that's good. You could be saving people some money right now. So then let's talk about the last step, because I know these are more invasive for sure, PRP and prolotherapy. But like you said, you like to use them after all the other aspects that you talked about are cleaned up and functioning properly. And then what's left over, I bet most of the time the pain is almost gone, if not completely gone at that point. But maybe for some tougher cases, why don't you tell us a little bit about what prolotherapy is and PRP? Because depending on how you read about it, sometimes it can sound scary.
Mm-hmm. Yeah, so first off, I hope to make this very unscary. They're both regenerative injection therapies, and how they work, the kind of why are we even doing them, is they provide a natural biochemical signal that tricks the body and makes it think it just got injured there, wherever the injection went. So then the immune system kind of perks up and says, hey, I think we got injured here. Let's recruit the troops and regenerate this tissue. So it's mimicking the same exact process that someone sprains their ankle or gets a cut in their skin. Like, we have these processes in us surveilling all the time. They're on alert for any type of injury, and so we're just recruiting that process, initiating the healing cascade, we would say, where the injections go. So it's really important that we have a very clear diagnosis, going back to what I was saying earlier, because if it's knee pain, it might not be one spot. It actually might be 5 spots across the whole area around the knee that are contributing to someone's pain picture. And maybe going through all the steps that we previously outlined, where a lot of that has healed and we're down to 2. Well, then we can use the prolotherapy or the PRP in those 2 spots and be very effective, versus 5 spots and be, we kind of got an improvement because we weren't addressing everything else there.
Right.
And
it's such a cool concept, right? That it's natural in a sense that you're really just calling the troops to come and heal something that feels or looks or is signaled as being new and fresh and needs to be fixed, even though it's something that's chronic. So just such a clever way of having the body take on its own natural healing process. That's great.
Yeah, and I love it. I got into it just looking into research and seeing these effects that I was saying, well, that sounds crazy. That sounds like science fiction. How can that really be the case? And coming at it from my own history, having chronic knee pain, I had knee surgery when I was 18 and had quite an extended recovery period, a lot of pain and swelling, and a short period of time I was in a wheelchair. I couldn't walk, and kind of going through that process really, really slowly, where even a decade later, when I was in medical school, I had a lot of instability and weakness, and that knee would just give out on me, and kind of that's the backstory behind my creating of all these steps is my process, what I went through, and then bringing that into my clinical experience, obviously informed by evidence, as you can all hear. So getting myself strong, and then using the prolotherapy and the PRP and I would say after three sessions total over the course of like a year, my knee doesn't stop me. It doesn't stop me in my normal life. It doesn't stop me in taking care of my farm acreage outside my window here. It doesn't stop me in weightlifting. So yeah, it's I'm really happy that I can bring this to my patients.
That's incredible. So I'm going to take it back. Let's step back now. Now that we're way down deep, let's pull it all the way back, because I think it's just a really like little stepping stones. If you think about little stepping stones through a garden, like if we look at joint pain and joint discomfort, we're very often looking at inflammation, right? And if there's more than one site, then it could be really inflammation that's more systemic even. And we know that inflammation actually sets up the body for the aging process, right? Things start to break down in the presence of these inflammatory chemicals or cytokines or compounds. So I guess from a high level perspective, the so what is that your joint pain could be significantly speeding up or accelerating your aging process. Is that fair to say? That's how I've interpreted it.
Yeah, it's really a snowball effect. Like they're kind of setting each other off.
Right. And it's negative synergy probably, you know,
Yeah,
a little
yeah.
both. So, wow. Amazing. That's incredible. So, Dr. Cortal, any other pieces of advice? I mean, obviously we talked about all these different things. What advice do you have for people that are on, like for me, for all of us on this path that are slowly working to improve all of these, you know, core health related side of aging, that we can impact our health that way?
Sure. I guess I would say start with your mindset and let me be, if you have not heard this message before, let me be the one that says not pain does not have to be permanent. I see the reversal of that every day in office, and that it really just takes a process of figuring it out, investigating it, individual for each person. So it can take time, and we can see some effects happen over weeks and months. So perhaps a quicker route of ibuprofen or cortisone injections or something like that can work really quickly. But it's about what each and every person's goal is. So if it's about really getting yourself to a different place, to a new plateau of your health, I just want to say it is possible. It's totally possible, and just put together your team, because my plan is to be as healthy and strong over the long term as possible for myself. And if it is for you, I encourage you. I encourage you to continue on your path.
For now, she has this wonderful checklist of 7 hidden causes of joint pain. So we talked a lot about this, but I think there's a lot more information in there that you can use, and you can also use that information to start a really healthy dialogue with your practitioner. Also, by going to evolvingageless.com and going right into our show notes, there's a link for that checklist. So definitely download that. But also there's information there for how to get in touch with Dr. Cortal as well, because she has 2 physical practices, but also a virtual practice as well. And it may be that she can help you. So what a wonderful gift that you've given us today. I truly thank you for taking your time. I know how valuable it is, and sharing your message, because I think you're really going to change or really are not going to, you are changing the lives of women absolutely around the country, if not around the world, as this message gets out and people understand that arthritis or whatever their diagnosis is does not necessarily mean it's permanent, and you can regenerate those areas of your body. It's so important and so helpful for all of us. So thank you so much for your time. I really appreciate it.
Well, thank you. Thank you for having me.
That's great. This was a great conversation. So also, if you have any questions, any other topics, definitely let us know. Go to evolvingageless.com and shoot us a quick email and let us know if you've got any other ideas or what you'd love to learn about next. But for now, we've got another week, and I'll be back a week from now, same time, same place. And I really look forward to hearing how everyone is taking these small steps and evolving ageless. I'll see you next week. Bye now.